Welcome back to Men's Health 365. Today we're uncovering something that might shock you. The everyday foods sitting in your kitchen right now could be silently undermining your health. I'm not talking about junk food or obvious culprits. I'm talking about foods that most people consider healthy, foods that doctors might even recommend, but that can create serious problems for men over 60. Before we dive in, if you're serious about protecting your health and staying strong as you age, hit that subscribe button right now. We upload new, evidence-based content every week that could literally add years to your life. Let me share a story that perfectly illustrates why this matters. Richard Thompson, a 72-year-old retired teacher from Melbourne, Australia, came to our attention after struggling with unexplained fatigue, muscle weakness, and concerning blood pressure fluctuations for over 18 months. Richard ate what he considered an extremely healthy diet, plenty of fruits and vegetables, whole grains, and he'd recently increased his intake of foods rich in vitamin K. After reading they were good for bone health, he was eating kale salads almost daily, drinking green smoothies, and snacking on Brussels sprouts. What Richard didn't know was that he was on warfarin, a blood-thinning medication prescribed after a minor cardiovascular event 2 years earlier. The massive increase in vitamin K-rich foods was directly counteracting his medication, putting him at serious risk for blood clots. His doctors had never explained that these otherwise healthy foods could be dangerous in his specific situation. After we helped Richard understand the interaction between his medication and his diet, he made strategic adjustments, not eliminating these healthy foods entirely, but maintaining consistent, moderate intake rather than the excessive amounts he'd been consuming. Within 6 weeks, his warfarin levels stabilized, his energy returned, and his blood pressure normalized. Today, 2 years later, Richard maintains perfect medication balance while still enjoying a varied, healthy diet. He just knows which foods require careful management. Richard's story isn't unique. Millions of men over 60 are unknowingly consuming foods that interact dangerously with their medications, deplete critical nutrients, or trigger inflammatory responses that accelerate aging and disease. Today, we're going to expose 7 categories of everyday foods that could be silently harming your health, and more importantly, I'll show you exactly what to do about it. Let's start with one of the most dangerous yet commonly overlooked food interactions: grapefruit. This seemingly innocent fruit appears on breakfast tables across the world, praised for its vitamin C content and refreshing taste. But for men over 60 taking common medications, grapefruit can be genuinely life-threatening. Research published in the Canadian Medical Association Journal identified over 85 medications that interact dangerously with grapefruit and grapefruit juice. These aren't obscure drugs. They include statins for cholesterol, blood pressure medications, anti-anxiety drugs, immunosuppressants, and even some pain relievers. The mechanism is fascinating and frightening. Grapefruit contains compounds called furanocoumarins that block an enzyme in your intestines called CYP3A4. This enzyme normally breaks down medications as they pass through your digestive system. When it's blocked, medication levels in your bloodstream can spike to 2 to 10 times higher than intended, essentially giving you a massive overdose from your normal prescribed dose. A study from the Lawson Health Research Institute found that a single glass of grapefruit juice can affect this enzyme for up to 24 hours, and regular consumption can cause effects lasting up to 3 days after you stop drinking it. For men taking statins like atorvastatin or simvastatin, this interaction can cause severe muscle breakdown, kidney damage, and even rhabdomyolysis, a potentially fatal condition where muscle tissue breaks down so rapidly it overwhelms the kidneys. For blood pressure medications, the interaction can cause dangerous drops in blood pressure leading to dizziness, falls, and loss of consciousness. Given that men over 60 already face increased fall risk, this combination can be catastrophic. The solution isn't complicated, but it requires awareness. If you're on any regular medications, ask your pharmacist specifically about grapefruit interactions. If there's an interaction, eliminate grapefruit and grapefruit juice completely from your diet. Don't try to time it around your medication. The effects last too long for that strategy to work safely. Other citrus fruits like oranges and tangerines don't cause these interactions and make perfect substitutes. Now let's talk about high potassium foods and kidney function. Potassium is an essential mineral that most people associate with heart health and proper muscle function. Bananas, potatoes, tomatoes, and oranges are celebrated for their high potassium content. But here's what most men over 60 don't realize. As kidney function naturally declines with age, your ability to properly excrete excess potassium diminishes, and high potassium foods can become genuinely dangerous. Research published in the Journal of the American Society of Nephrology found that approximately 50% of adults over 70 have some degree of reduced kidney function, often without knowing it. When kidneys can't efficiently remove potassium, levels build up in the bloodstream, causing a condition called hyperkalemia. Hyperkalemia isn't just uncomfortable, it's life-threatening. Excess potassium disrupts the electrical signals in your heart, causing irregular heartbeats and, in severe cases, sudden cardiac arrest. A study in JAMA Internal Medicine found that men over 65 with even mild kidney impairment who consumed high potassium diets had a 47% increased risk of cardiovascular events. This danger is amplified if you're taking certain common medications: ACE inhibitors and ARBs for blood pressure, potassium-sparing diuretics, and NSAIDs for pain all reduce potassium excretion. Combining these medications with a diet high in potassium-rich foods creates a perfect storm. The symptoms of high potassium are often subtle until the situation becomes critical: muscle weakness, irregular heartbeat, nausea, and tingling sensations. Many men dismiss these as normal aging symptoms until a routine blood test reveals dangerously elevated potassium levels. The solution requires 2 steps. First, if you're over 60, ask your doctor for a comprehensive metabolic panel that includes kidney function tests and potassium levels. This simple blood test reveals whether you need to monitor potassium intake. Second, if your kidney function is reduced or you're on medications that affect potassium, work with a nutritionist to moderate your intake of high potassium foods. You don't necessarily need to eliminate these foods entirely, but you need strategic management. Instead of a large banana every morning, have a small one 3 times per week. Choose white potatoes over sweet potatoes occasionally. Leach potassium from vegetables by cutting them small and soaking them in water before cooking. The third danger involves calcium-rich foods and iron absorption. Dairy products and calcium-fortified foods are heavily promoted for bone health, especially for older adults. But here's a critical interaction that most men don't know about. Calcium significantly blocks iron absorption, and this combination can contribute to anemia, fatigue, and cognitive decline in men over 60. A study published in the American Journal of Clinical Nutrition found that consuming just 300 milligrams of calcium with a meal, the amount in 1 cup of milk or yogurt, reduces iron absorption by approximately 50 to 60%. For men who aren't consuming much red meat or who have marginal iron stores, this interaction can be devastating. Iron deficiency isn't just about feeling tired. Research from the Journal of Nutrition, Health, and Aging demonstrates that iron deficiency in older men is associated with decreased cognitive function, increased risk of falls due to muscle weakness, compromised immune function, and significantly reduced quality of life. The problem is particularly insidious because it develops gradually. You don't suddenly become anemic. Instead, your iron stores slowly deplete over months or years. By the time symptoms become obvious, you're significantly deficient, and recovery takes considerable time. This danger is amplified for men taking proton pump inhibitors for acid reflux or heartburn. These medications already reduce iron absorption by decreasing stomach acid. When combined with high calcium intake at meals, iron absorption can drop to critically low levels. The solution is about timing and balance, not elimination. Calcium is essential for bone health, especially for men over 60, but strategic consumption makes all the difference. If you're eating iron-rich foods like red meat, beans, or fortified cereals, Avoid consuming calcium-rich foods at the same meal. Have your calcium-rich foods at different times of the day. For example, if you have a spinach and beef stir-fry for dinner, skip the glass of milk with that meal. Have your dairy earlier in the day when you're not consuming iron-rich foods. If you take calcium supplements, take them at least 2 hours away from iron-rich meals. Additionally, enhance iron absorption by including vitamin C-rich foods with iron-containing meals. A glass of orange juice, bell peppers, or strawberries with your iron-rich meal can increase iron absorption by up to 300%. Our fourth danger involves tyramine-rich aged foods. This category includes foods often considered sophisticated and healthy: aged cheeses, cured meats, fermented foods, and even soy sauce. These foods contain high levels of an amino acid called tyramine, which can cause sudden, severe blood pressure spikes in men taking certain medications. The danger specifically affects men taking monoamine oxidase inhibitors, or MAOIs, which are sometimes prescribed for depression or Parkinson's disease. But many men don't realize that some other medications, including certain antibiotics like linezolid, have MAOI properties as well. Research published in the Journal of Clinical Psychiatry documents that consuming tyramine-rich foods while on MAOIs can cause hypertensive crisis, a sudden, extreme spike in blood pressure that can lead to stroke, heart attack, or death. We're talking about blood pressure jumping from normal levels to over 200 systolic within minutes of consuming these foods. The mechanism involves tyramine triggering the release of norepinephrine, a hormone that constricts blood vessels and raises blood pressure. Normally, MAO enzymes in your gut and liver break down tyramine before it can cause problems. But when you're on MAOIs, these enzymes are blocked, allowing tyramine to flood your system. A study from the American Journal of Emergency Medicine found that aged cheeses pose the highest risk, with some varieties containing over 2,000 micrograms of tyramine per serving. Aged cheddar, blue cheese, Parmesan, and Swiss cheese are particularly high. The symptoms of a tyramine-induced hypertensive crisis include sudden severe headache, rapid heartbeat, nausea, vomiting, confusion, chest pain, and vision changes. This is a medical emergency requiring immediate treatment. The solution is straightforward, but requires diligence. If you're on MAOIs or any medication with MAOI properties, you must strictly avoid all high tyramine foods. Your doctor should provide a comprehensive list when prescribing these medications. Even if you're not on MAOIs, be aware that as foods age or ferment, tyramine levels increase. That leftover meat that's been in your refrigerator for 4 days has much higher tyramine levels than when it was fresh. The fifth danger involves vitamin K fluctuations and blood thinner instability. We touched on this with Richard's story, but this interaction is so common and so dangerous that it deserves deeper examination. Vitamin K is essential for blood clotting, but for the millions of men over 60 taking warfarin or similar blood thinners, vitamin K-rich foods create a dangerous balancing act. Research from the New England Journal of Medicine indicates that warfarin is directly antagonized by vitamin K. The more vitamin K you consume, the less effective your blood thinner becomes. But completely eliminating vitamin K isn't the answer either, because that makes your blood too thin, increasing bleeding risk. The danger lies in inconsistency. A study published in Thrombosis Research found that men who had the most variable vitamin K intake had 3 times higher risk of either excessive bleeding or dangerous clotting compared to those who maintained consistent vitamin K consumption. The highest vitamin K foods include kale, spinach, collard greens, Swiss chard, Brussels sprouts, broccoli, and asparagus. Just 1 cup of cooked kale contains over 1,000 micrograms of vitamin K. A single meal heavy in these foods can throw your blood thinner levels off for days. Many men decide to get healthy and dramatically increase their vegetable intake without realizing the consequences. They start drinking green smoothies daily, eating massive salads, or following trendy kale-based diets. Within weeks, their carefully calibrated warfarin becomes ineffective, putting them at serious risk. The solution is consistency and communication. If you're on warfarin, you don't need to avoid vitamin K-rich vegetables. They're too healthy to eliminate entirely. Instead, consume them in consistent amounts. If you eat a cup of cooked spinach 3 times per week, continue doing that. Your doctor will adjust your warfarin dose to account for your typical vitamin K intake. What you must avoid is dramatic changes. Don't suddenly start eating huge amounts of leafy greens if you haven't been. If you do need to make dietary changes, inform your doctor so your warfarin dose can be adjusted and your blood levels monitored more frequently. Our 6th danger hides in foods marketed as healthy alternatives. Low-sodium products, meat substitutes, and foods labeled heart-healthy often replace sodium with potassium-based salt substitutes. For men over 60 with kidney issues or on certain medications, these healthy swaps can be extremely dangerous. Research from the Clinical Journal of the American Society of Nephrology found that potassium chloride, the common replacement for sodium chloride in low-sodium products, can cause hyperkalemia. But because these products are marketed as healthy, men consume them liberally without realizing the risk. A study examining low-sodium vegetable juices and broths found that a single serving of some products contains over 800 milligrams of potassium. Men drinking these products multiple times daily can inadvertently consume massive amounts of potassium. This problem is amplified in meat substitutes marketed to older adults. Many plant-based burgers and protein products contain extremely high levels of potassium. A study published in the Journal of Renal Nutrition found that some popular plant-based meat alternatives contained up to 4 times more potassium than the real meat they replaced. The solution requires careful label reading. If you have kidney function concerns or take medications affecting potassium, examine nutrition labels specifically for potassium content. Be particularly careful with products labeled low sodium or heart healthy. These are exactly the ones most likely to contain high potassium. Our 7th danger involves oxalates. These naturally occurring compounds are found in many foods considered extremely healthy, and for men over 60, excessive oxalate consumption significantly increases kidney stone risk. Research published in the Journal of Urology indicates that kidney stone incidence increases dramatically with age. Oxalates bind with calcium in the kidneys to form stones. The highest oxalate foods include spinach, rhubarb, beets, Swiss chard, chocolate, nuts, especially almonds, and even some teas. A study from the American Journal of Kidney Diseases found that just 1 cup of spinach contains over 700 milligrams of oxalates, far exceeding the recommended daily limit for kidney stone prevention. What makes this particularly dangerous is that many men are increasing their intake of these exact foods for other health reasons. They're eating more nuts for heart health, more spinach for nutrients, and more plant-based proteins. Each individually healthy choice contributes to dangerous oxalate accumulation. Additionally, as we age, our gut health often declines, reducing populations of oxalate-degrading bacteria. Research from the journal Gut Microbes shows that men over 60 have significantly lower levels of bacteria that metabolize oxalates. Without these bacteria, dietary oxalates are absorbed more readily, increasing kidney stone risk. The solution involves moderation and strategic pairing. If you eat high oxalate foods, consume them with calcium-rich foods. The calcium binds to oxalates in your intestines, preventing absorption. For example, if you eat spinach, have it with cheese or yogurt. If you eat almonds, have them with milk. This strategy reduces oxalate absorption by up to 50%. Additionally, stay well hydrated. Drinking adequate water dilutes urine and helps flush oxalates before they can crystallize into stones. Limit high oxalate foods to once daily rather than multiple servings, and rotate your vegetable choices rather than eating the same high oxalate greens every day. What these 7 dangers illustrate is a critical truth. Nutrition after 60 isn't one size fits all. Foods that are healthy for one man might be dangerous for another based on medications, kidney function, existing health conditions, and individual metabolism. Research from the Journal of the American Geriatric Society emphasizes that Personalized nutrition based on individual health status is essential for men over 60. The solution is a comprehensive approach. First, maintain an updated medication list and discuss potential food interactions with your pharmacist and doctor every time a new medication is prescribed. Second, get regular blood work that includes kidney function, electrolytes, and vitamin levels. Third, consider working with a dietitian who specializes in geriatric nutrition. Fourth, keep a food journal when you start new medications or notice new symptoms. Finally, remember that healthy is context dependent. Grapefruit is healthy unless you're on statins. Spinach is nutritious unless you're on warfarin and eating it inconsistently. Bananas are excellent unless your kidneys can't handle the potassium load. There are no universally good or bad foods for men over 60, only foods that are appropriate or inappropriate for your specific situation. Before we wrap up, I want to hear from you. Drop a comment below letting us know what country you're watching from. We have viewers from all over the world, and I love seeing this global community of men committed to better health. And please, if you found this information valuable, hit that subscribe button. Most men don't know about these hidden food dangers until they experience serious consequences. By subscribing and sharing this content, you help us reach more men who need this life-saving information. Remember, the everyday foods in your kitchen should support your health, not undermine it. With awareness, strategic choices, and personalized approaches, you can enjoy nutritious, delicious meals while avoiding these hidden dangers. Your health after 60 doesn't happen by accident. It happens through informed choices made every single day.